Hello, this is Dr. Gay from First Look MRI, and I want to talk for a moment about MRI and CT. What is the difference? So I'm going to start off with a picture of a CT scanner. So if you look at a CT scanner, you see this tube, a wide tube, and from front to back, it's pretty shallow. So if you glance in at a CT scanner, you can see that from front to back, it's fairly narrow, and you can see a table in the front. Now, with CT scan, it's a very quick procedure. You lay on the table, and it pulls you in continuously, and then it pulls you out really quickly. So in a matter of seconds, you can have a CT scan. But an MRI scan is different. An MRI scan, you have to lay inside a tube for 20 minutes to 45 minutes, and it's very loud, whereas a CT is very quiet. Now, an MRI kind of looks like a CT scan at first glance. You see both of them are donuts, both tubes, but an MRI scanner is much, much deeper. It's a much larger, heavier piece of equipment. And again, it takes a lot longer to scan. So if you just glance into an MRI versus CT for a few seconds, you may be confused. But if you think about it, one of them is going to be very, very long and deep and very large. The other one's going to be a very light piece of equipment and very shallow and open. So this is a classic MRI scanner here with the tube. And this is an open MRI scanner. You probably heard the term of an open MRI. Well, this is what it looks like. It's just a magnet up front and a magnet in the back here. And the patient lays in here. And the magnetic field strength is much smaller than on this configuration, but patients are less claustrophobic. Now, a CT scan is really just an X-ray. It uses X-ray beams to generate the CT images. So it does have ionizing radiation, and if you think about it, it will look a lot like an X-ray looks. So an MRI is very different. It's a completely different thing. It uses magnetic fields and radio waves, and so there's no radiation. It's a completely safe procedure as far as that goes, just a magnetic field and radio waves. And again, the physics is pretty doggone complicated, so we won't go into that. And this is just a picture of a CT scan. So again, CT scan is just an X-ray, so things look like they would look under X-ray. So this is dense contrast within bowel. So this looks really white on the CT. On an X-ray, this would look really white, just like this. This back here is bone. Remember, bone on CT scans, we all know, looks really white. So this is a bone on CT scan, really white. And over here is air on the outside. And this is fat in the body. Both of these are really dark. And on X-ray, again, air and fat are really, really dark. And this is soft tissue here, this muscle back here, this is the liver here, this is muscle around the sides. Now MRI is very different. You can make MRI look however you want it to look. So there's not just one sequence. On CT scan you have one sequence because everything is going to look the same, but on MRI you have multiple different sequences, usually a minimum of 5, and sometimes 10 or 12 different sequences. And in every sequence, things will look different. So for example, this one, fluid is white around the periphery of the brain, and this one, fluid is dark around the periphery of the brain. And here you can see these little white matter specks. These are little tiny lesions within the brain, and on this sequence and this sequence, you really can't even see them at all. So MRI does look very, very different. So that is the end of the tour. Just one quick thing. Can you tell which one is the CT scan? So we've discussed this. CT scan looks like an X-ray. So if you look over here, it looks a whole lot like an X-ray, doesn't it? You have a white cortical bone. You can see this dark fat. You see the air over here. And you can imagine if you're looking at an X-ray, you think about that, you see this bone and you really don't see too much else. Now this is MRI, and MRI can look different depending on the sequence. So here, marrow is really bright, fat is bright, and this one, fat and marrow are really dark. And fluid is bright here, a little cleft of fluid. So that is it. Thank you guys so much for your attention, and hope you have a great day.